reading, what time you're watching. We're here today at the Irlam and Cadishead COVID long support peer group. Would that be the correct saying? Close. John will tell you. But the good news is, Fred's been to the dentist and he can't speak. So we should have a quiet, peaceful chat. Joan, how long have you been going?
Well, we only started last week. Hi everybody. We started last week, and we started as a result of Fred having coronavirus and seeing how poorly he'd been, and knowing that he was feeling very isolated by it. Also, I looked into what was best things that would support people who had long COVID, and what we found at the time was peer support is what's recommended for people, and that basically just means people who are suffering from the same condition meeting up and talking to each other so that they can discuss all the symptoms and problems that they're having with long COVID, because as everybody knows, it's all uncharted waters. We've got no history, we've got nothing to look back on, so it's a difficult time. If anyone who knows me knows that I work at Helping Hands, and we're Salford City Council's minor repair service, and we have staff who go out into people's homes, of vulnerable Salford people as well as the general population, and my staff have been telling me that they're going into the homes of people who haven't been out for 2 years, either because they've had coronavirus or they're scared of getting it. And so it made me think that we need to kind of actually go back a bit further and access people at home. So we're extending the service provision to go into people's homes and give them support to get back out into society again. As I've already said, it's a very, very isolating condition with a host of new and wonderful symptoms that happen on a daily basis. And seeing someone you love going through that is really, really difficult, because there's not a great lot that you can do to help them. And it's been very, very hard for Fred, but also hard for his family and people who love him to watch him going through that. So kind of basically, in a nutshell, that's what the long COVID peer support is about. So Brenda is the development worker for the peer support, and probably at this point I should say that Helping Hands is a not-for-profit company, but we also have a charity called HH Community Salford, and so Brenda's employed by Helping Hands, but this service is being run under the charity arm of the organisation. And some people out there will know us because as part of that work we provide wheelchairs and other kind of medical aid equipment to Salford people, and anyone who's come across our Paul Smith, who's our main worker in that service, absolutely love it, and it's a totally free of charge service. And so Brenda and this service is part of what we would call Helping Hands social value for Salford input. So Brenda, how many people are suffering with long COVID?
At the moment we've about 1.3 million people in the UK suffering, and the symptoms can be like 205 different symptoms. Nobody's symptoms are the same. Like the two people who met here last week, they were discussing their symptoms, and they're just not the same at all, are they? And that's the problem with most
Have you
people.
both had COVID?
Yeah,
Yes,
we both had
Have
COVID.
you had all your injections?
Yes,
Yes,
had all the injections.
Yeah, I'm used to it, yeah.
I have obviously had COVID. The symptoms I've had was tiredness a hell of a lot,
Yeah.
lethargy.
Yes.
Now somebody thought, I'll do that later, I'll do that
Yes.
later. And is that a common symptom, do you think, or as
I
you
think
say,
it
everyone's
is.
different?
No, I think yes, it is. But the long COVID, it's just going on. Like poor Johnny's had like 18 months, isn't it? Something like that. Yeah. So it's.
Terrible illness, isn't it? I suppose.
Very
And
debilitating.
the thing that
yeah.
I do find disappointing, people still say, it's happened to me with friends of mine, oh, there's no such thing, you're being brainwashed. It's I don't know, it's stupid, isn't it? Really is.
Well, Fred can't speak at the moment,
Yeah,
unfortunately,
no.
because of his dental work, but I can speak for him because Fred who was kind of sceptical about it all. But obviously being through what he's been through, and I mean I've got to say when Fred was in hospital, doctors were ringing me and they weren't really expecting to see him through, for him to see through the night. It was horrendous, it was really awful, and made worse by the fact that you can't even go and visit your loved ones. It's awful, and because he was so poorly, he couldn't speak to me either on the phone. It's just awful. I mean, he's had weird and wonderful symptoms like his ear bleeding. You know, what's that about? It's also, I wasn't going to mention that, but it's okay me telling you, the other really awful one, and this was only a few days ago, his penis was bleeding. So it's, you know, it's true, you know, it's really awful. So, you know,
He told me he trapped it at the door.
a lot of red blood, you know, from your penis. It's just horrendous, and having that support of other people who've had it is kind of the best thing that can happen. Freddie had the tremors, constant tremors,
Milking it in it.
tiredness. Fortunately, I mean, and I don't know how I even got it, because when I got it, Fred was in hospital. When he went in hospital with COVID, I isolated for 10 days, didn't see anyone, didn't do anything, which was the prescribed time at the then. And then after that time, I didn't really go anywhere because I was at home listening for the phone in case the hospital rang, because he was critically ill. And I had to go into hospital for minor surgery myself, and I thought, well, I'll go and have this done because it will distract me from being concerned about Fred. But as part of that, I had to go for a PCR test, which I went for, and she rang me 2 days later and said, you tested positive for coronavirus. I was absolutely amazed because I hadn't actually been anywhere. I'd been in the house all the time with probably a couple of forays to Tesco. So again, I couldn't have the surgery and I had to re-isolate. So, but I've no idea. And I was double vaccinated as well at that time since I've had the booster.
I think every victim, we should call it that, they've all got different stories to tell them how they possibly contracted the illness, or
I think
the way of touching it, breathing it. It's just strange.
I think it's rife, isn't it? And I think how you got it is irrelevant. The thing is that you have got it. Unfortunately, I didn't have any symptoms. The only symptoms I had were loss of smell. I put perfume on, I thought, I can't smell that, but my nose was running. But as anyone who also knows me knows, I have got a constantly dripping nose, so no change there really. So I would say that I didn't have symptoms. I know that Brenda was really quite poorly. And Fred even got it again a few weeks ago. We thought it was a chest infection, and I got antibiotics, but then we did the lateral flow test and he was positive. So you can get it more than once. Tony, you've had it.
Yeah. My symptoms, which I thought were actually a bit of a cold, and the throat was aching, a bit of headaches. The symptoms of a flu, I would describe it.
Yeah.
I took the flow test and positive.
Yeah.
I was quite shocked, to be honest, because we're having all the injections, and I had to do self-isolate for 5 days and then 2 negative tests. I did all that, but it just shows, doesn't it? You know, it's a bit frightening. What I would like to say though is, this group you've set up for the people of Irlam and Cadishead, how can they contact you? Do you have a contact details? Or is it the Rooster Cafe
we do.
now?
Yeah, thanks Adam. Adam runs a Rooster's Cafe on Princes Park Garden Centre, and that's where Helping Hands has its office. And bless him, Adam has kindly allowed us to use all his facilities for our long COVID support groups. I mean, anyone who knows Adam is fantastic. It's great anyway. His cafe's great, the food's great. He does evenings on a Thursday, so you can always come and get a special meal, bring your own wine, and it's a real bargain. So thanks a lot, Adam, really do appreciate you helping us.
But this is where they can come now if you watch this.
On a Wednesday.
Wednesday at 4 o'clock here. You can ring Helping Hands switchboard on 0161 793 9419. Ask to speak to Joan or Brenda, or even obviously you can speak to our staff, and they will, pass messages can email us, you can contact us through Facebook, you can contact us through our website, Helping Hands website. The real concern for me at the moment is that we want to get people who have been cut off from society by this dreadful illness, whether they've had it or not, back out into society again and living normal lives. We have been working alongside Salford Royal Trust their clinics, and Brenda can tell you more about that, and Public Health Salford as well. So, you know, we can refer people to other appropriate services. For those of you who maybe can't get transport, you can get a taxi, get your receipt, and we'll give you taxi money. Or, as I say, we will come out and visit you in your own home. Brenda?
Because that's what we're looking at doing now, aren't we? Doing home visits.
Yeah.
And then trying to encourage people to come to the group.
Yeah. We know it's going to take time for people to regain confidence. It's been a terrible thing. Yeah. But we're about Salford people. We are Salford people. We're passionate about our other friends and family in Salford. We work in the community to improve the lives of those people in Salford. And for those of you suffering, we're happy to take as long as it takes to get you back out there, back in society, living normal lives. We're very passionate about what we do. It's important to us, isn't it, Brenda?
So the message is basically, if you're suffering from long COVID, or you've been affected by the long COVID, you can come and visit you here at the cafe at 4 o'clock
on a
Wednesday.
After 4.
You can have chat, meet people of a similar disposition, shall we say, and hopefully we'll thrash something out for them.
Yeah.
It's a helping hand, isn't it, to the people who are, no pun intended there.
No.
But to the people who are bad, isn't it?
Yeah.
Is there anything else you'd like to add before we... It's not licensed, by the way.
Oh, if you come for a meal though on a Thursday,
You can bring your own.
Bring your own wine, and I understand that tomorrow night is steak night, and he's absolute fabulous chef, Adam, and bring your own wine. He has 2 sittings on a Thursday.
Excellent.
Oh,
Come along to us on a Wednesday.
The main thing is Wednesday, 4 o'clock, Rooster Cafe. Come and meet like-minded people and see what you find out. Let us know.
Okay,
Thank you.
Thank you. Cheers.
Thank you.